Dr. Tornatore has been my neurologist for 18 years, and he has encouraged me every step of the way in everything that I have wanted to do. Continuing to be active, continuing riding, exercising, and also my mental wellness with the philosophy of movement is medicine. When I was 17, I started this journey of having MS. My lips had gone numb, and I thought it was a reaction to some chapstick or a lip product of some kind. And I didn't really think anything of it until that numbness and tingling started moving up the left side of my face and down my neck. My pediatrician sent me for an MRI. With the results of the MRI, we went to Georgetown to see Dr. Tornatore for the first time, and that MRI showed 7 lesions on my spine and 3 on my brain, with kind of a classic presentation of MS. At the time, it just kind of was all a little bit surreal. I was an active horseback rider. I didn't think I really believed it at first. Dr. Tornatore was incredibly reassuring through the whole thing. We talked about the different drugs that were on the market, the best drugs for my age and the best drugs for the way my MS was presenting, and what that was going to look like.
Multiple sclerosis is an inflammatory disease of the brain and spinal cord, and it tends to affect young people initially, like Veronica in their teenage years or their 20s or 30s. And as such, this is a lifelong disease. I've been doing this now for almost 35 years, and I have patients that we've grown older together. And so because there is that relationship, there's a therapeutic bond there, but it's extremely important because you're going to see people through different stages of their life.
He has encouraged me every step of the way and helped me make therapy decisions to continue to be able to do all of those things. As we've kind of had stumbling blocks, I've had problems with vision, I've had problems with fatigue. I started to suffer from something called foot drop, where you can't do the dorsiflexion to keep the foot up. He's helped me figure out what we can do in terms of treating the MS, and then branching out and talking to physical therapists and talking to physiatrists and my support system through the whole thing. And the horses are so important. Tornatore believes that I was actually able to keep my MS managed because of the horses. And then when I wanted to have my own family, he was incredibly supportive. And we talked about the risks, because there are risks, but he also talked about kind of what was possible, and that if that's what we want to do, then we're going to make that happen.
So being active is extremely important in the care of someone with MS. We like to think that our MS medications, help to treat the disease, which they do, but I always say that's maybe only 50% of the treatment. The other 50% really comes down to staying active, eating right, getting good sleep, and really just taking good care of yourself.
I'm a para-athlete, so I compete in para-dressage, which is dressage for individuals with disabilities. It gives me goals, it keeps me emotionally invested, it keeps me physically strong. The hippotherapy, the movement of the horses, the core strength, all of that helps managing the mobility aspects of my disease. Yep, I have days where MS is hard and MS is painful and I don't want to go do infusions. That doesn't get me anywhere. But I have treatment options, and I just always choose to look at the sunny side. And so for me, there's very few times where you can't find any silver lining.